Question 3, which of the following mechanisms most likely explains this patient's symptoms? Okay, so that tells me nothing. For the past 2 questions, it's been pretty helpful, that strategy of starting with the question part first, but it doesn't always work. So now I'm actually going to briefly peruse the answer choices very quick, like less than 3 seconds. Impaired baroreceptor reflex, ventricular arrhythmia, global cerebral hyperfusion seizure, paroxysmal sympathetic. Okay, so it seems like neuro, maybe cardio is what this question is about. Great, so that gives me at least a hint of what I should be thinking about. I shouldn't be thinking GI when I'm reading through this. Now we'll start at the top. 62-year-old man brought to the clinic after a brief syncopal episode. Okay, that makes sense. The 2 systems you should be thinking of when you see syncope are cardio and neuro. So that matches up. Heard while he was getting ready for a wedding, standing in front of a mirror, buttoning the top of his shirt and tightening his collar. This is like classic for this presentation. They're absolutely classic. They love testing this occasionally. I wouldn't say this is super high yield, but I have seen a few questions on it in my day. Suddenly felt lightheaded, nauseous, collapsed, regained consciousness within a few seconds, and was alert and oriented afterward. This is really important. If somebody had a seizure, they are not alert and oriented immediately after waking up from a seizure. They're in a post-ictal state. They're confused, they're dazed, and they make sure to let you know that. Right? And we know he didn't have a seizure because they told us. Okay, so let's think buttoning the top of the shirt and the guy collapses. That's pretty strange. Is there anything we can cross off? Let's just assume we have no idea what's happening here. Let's see if we can use logic to cross off any of these answer choices. I'm seeing here, seizure. Literally, they said there's no seizure. If you pick this one, I forgive you, but I'm a little disappointed. Paroxysmal sympathetic overdrive from catecholamine excess. What the heck does that mean? So catecholamines like epinephrine, norepinephrine, dopamine. I mean, it kind of sounds like a pheochromocytoma, maybe? Global cerebral hypoperfusion from reduced plasma volume. Reduced plasma volume. Is he bleeding out? That doesn't make any sense. Where did the plasma volume go? Cross that one off. Ventricular arrhythmia due to structural heart disease. Okay. I mean, it's possible. They didn't tell us anything about the heart, but I suppose it's possible, so I won't cross it off. Impaired baroreceptor reflex due to carotid sinus hypersensitivity. So we're on A, B. Honestly, I don't think E is a great choice, but let's say we're not totally sure. Like maybe this is a pheo, maybe they're talking about something else I've never heard of. It's possible. But we were able to eliminate C and D. And that's how I need you to go through these tests. Part of being a good test taker is being a good guesser. And this is how you do it. So buttoning the top of his shirt and tightening his collar. What do you suppose is at the top of his shirt where the collar is? Does this look familiar? That's right. It's a Y. No, this is the bifurcation of the carotid artery. So the green things are not lymph nodes. Those are supposed to be your carotid sinus, your baroreceptors, whatever. I didn't go to art school for a reason. But let's say that we are suddenly squeezing this really hard. We put some pressure on these carotid sinus, these baroreceptors. Remember, baroreceptor, baro means pressure. So these are receptors for pressure. If we suddenly squeeze these baroreceptors really hard, that means the baroreceptors are going to start sending signals to the brain saying that there's a lot of pressure here. Crazy, right? Medicine is so hard. But what does that specifically mean? What does the brain interpret that as? Does that interpret a collar being a little too tight? No. The baroreceptors are supposed to detect blood pressure, BP. So if the baroreceptors send a signal to the brain saying there's too much pressure, they're saying there's too much blood pressure. Now you can get in the nitty gritty, like do this carotid sinus, does it send sympathetic signals, does it send parasympathetic signals? It doesn't matter. Like I think that's so much overthinking, unless it specifically asks you, which sometimes it does ask you the specific mechanism. Here it's not. It just wants to know what's happening. If the receptors tell the brain there's too much blood pressure, the brain is going to decrease blood pressure. It can do that by decreasing sympathetic tone going to the heart and vasculature, or increase parasympathetic tone going to the heart and vasculature. Either way, let's say we're going to the heart here, our cardiac output is heart rate times stroke volume. Or in other words, it's your chronotropy times your inotropy. Or those fancy physio terms that nobody likes. If we have less sympathetic tone, we decrease our heart rate. We decrease our chronotropy. If you have less sympathetic tone, you have less inotropy, less contractility. Either way, cardiac output drops. Or if you have increased parasympathetic tone, You have less heart rate and you have less stroke volume. But same exact mechanism, just kind of opposite ways to do it. So the net effect is that our cardiac output takes a nosedive. And that is why this guy passed out. This doesn't happen in everybody, right? This is the hypersensitivity part. Some people are more prone to this. This can happen to people when they turn their head. Kind of a classic case of survival of the fittest.